Welcome. Today we want to talk about colic. My name is Nasan. Most parents are worried when their baby cries. It is good for us to know as parents that our babies communicate through crying. They don't have a specific language. Therefore, when they want to say thank you to anything or they want anything like feeding, changing, or even to change position, their language will always be crying. So that is their language. You should not be so worried when they cry. But when it comes to colic is when your baby is crying uncontrollably for more than 3 hours in a day and more than 3 days in a week. If it is uncontrollably, therefore it can be say that this is colic. And actually we need to know what are some of the contributing factors to colic, because there are no specific causes of colic. There are some things that will make your baby develop colic. Actually, when our babies are born, most of their digestive systems are not yet developed fully. So when they start feeding, like breastfeeding or formula feeding, it ends up making them to get colic. And as we know, colic starts within 2 to 3 weeks after birth and it ends within first 4 months. Therefore, we have to be very careful on what we are eating as mothers and what we are giving to our babies if they are on formula feeding, because it's going also to contribute on the colic issue. There are also what we call ingestion of the gas, like when they are breastfeeding they take in a lot of gas, maybe due to poor latching technique. Therefore it is good for us to ensure that we are able to breastfeed our babies well without taking in gas. And if they are taking in any case they have taken in gas, it's good for us to ensure that we burp our babies to ensure that this gas has come out. There are also what we call imbalance of healthy gut bacteria. Our digestive system usually have what we call normal flora, but if there is any imbalances in between them, for the babies it will make them have colic. There is also emotional sensitivities. Most of our babies are very sensitive. When they were in the tummy, they were used to a specific environment, calm, just in warm environment, but now they have come out, they are just trying to adapt to the new environment. Make sure you learn your baby, spend most of your time with the baby so that you can be able to know what your baby is more sensitive. If it is hotness, if it is noise or something else, it is good for you to be able to learn your baby well. Also, sometimes they are just having what we call food intolerance or allergies. When you master what you are giving your baby, if you have been able to give this food and the baby cries, and when you give the other one the baby doesn't cry, then focus on what is good for your baby. If it's breastfeeding, focus on breastfeeding. And for me, I'll always go for breastfeeding. Breastfeeding will never go wrong. So ensure that you are learning your baby very well. Know that there are no specific reasons for colic, but colic is there, colic is real. So just it's good for you to know what might be contributing to the colic to your baby.